Good morning, Mr. Chair and Commissioners. We have our weekly COVID case information, and I think you have that one-page sheet. So it's showing the totals again of Minnesota positive cases. So they are at 56,560 with 622 new reported cases, 1,616 deaths, so 2 additional deaths since the last amount that they had. And then Clay County, we are up to 745 positive cases, 2 newly reported cases, and we have 40 deaths. That was just 1 additional death from the 39 that we had previously. So Minnesota has now completed 1,070,000 completed tests on 8/2. They've had 15,870. So, you know, their goal was to hit 20,000. So they're doing pretty well with the testing. They test with the MDH Public Health Lab, which is very minimal. Most of their testing is done through other external labs that they use. Hospitalizations are up a bit in Minnesota. So there's been a little bit, about a 5% increase in the number of people that are hospitalized in non-ICU beds. And there's been an increase in the number of patients in ICU as well. So there's been a little bit of an increase in those. It's moderate. It's not an extreme high level, but just to note that that's what's happening.
Kathy, can I interrupt really quickly?
Sure.
Sorry. So the positive cases for Clay County is at 745, and it says there's 2 newly reported. Is this a daily sheet? Because our confirmed
Yes.
cases last week was 707.
Right, yes.
Okay.
So, and daily they change those and they fluctuate because first there's preliminary information that they give us and then they have confirmed information later.
And then in terms of Clay County's active cases, that's not included in this information today. Do you have that?
You know, I have the active cases from the 28th, which was 16.
Yeah, I have that one.
Yeah, and I don't have the active cases for this week. I apologize. I can
Okay.
get that for you though.
Okay, and then my other question is, I know that we're kind of in that second rise. The hospitalizations in intensive care right now is 153, but when it hit its peak a couple months ago, what was it, in the 190s?
190s, yeah.
Okay, all right.
And again, the hospitalizations are across the state of Minnesota. So that doesn't include, of course, Sanford and Essentia over on the Fargo side, which most of the Clay County residents would be hospitalized at.
I
So
know
this-
we've talked about that a million times probably, but is there any way we can get that so that residents can get a better snapshot of what's happening?
Right, and I'm working with emergency preparedness individuals at Sanford and Essentia to try to get that exact number of Minnesota people that are hospitalized or in ICU. So they're hoping to get me some of that data. I don't know if I'll get it weekly.
I think even though just to track what they're seeing within the Fargo-Moorhead region, even if it's not isolated to Minnesota residents, so that we can better see trends.
Yeah, waiting to hear back from them, but yeah, that would be good. The numbers are lower, of course, than the Minnesota hospitals, so they aren't at a capacity. So that's been positive, but I'll try to get those numbers. I've been working on getting those. It's a little bit of a challenge, but we'll try to work on that. Any questions other than the number of active cases, which fluctuates all
I would
the
just
time?
like to say that this format that you have been giving us, I really like this format.
Okay.
I don't see it here today, so.
We can still give that to you. The numbers fluctuated so much, we weren't sure
Yeah,
if
well, that's
if you
why I
were
like to see
interested
it.
in the inaccurate numbers, but we'd be happy to
I think-
send those to you.
I think what he's saying is we keep all of these, and so even though they're fluctuating, we're able to look back on it and it
Sure.
helps us get a better sense.
And see the rates, sure, yeah. And of course, they're across the nation, you see the fluctuation of hot spots and what's been going on. The the Commissioner of Health is still concerned about people following the advice and listening to the public health advice about masking, social distancing. So there's still some concern about some outbreaks in large group settings, so events that are happening. So she just, again, wants to remind the public, and we do too, that it's very important to continue the social distancing. Even though we're not in a hotspot area, we don't want to become one. So the social distancing, the masking, washing your hands, following all of those things, the guidelines that we have talked about, it's our only means to put a crimp on COVID spread. So we're really pushing that. There's some events coming up that might be of concern, but that's kind of the push, is to be diligent. As much as we maybe are tired of hearing about that and tired of masking and doing all those prevention methods, that's all we have right now. So, and then the second page I have is Minnesota has come out with a 14-day COVID case rate. And so I gave you a sheet that you can look at Clay County's. It's over a 14-day period per 10,000 people. So they have a formula that they're using, and this may help. This is one of the tools in the toolbox for schools to determine what they should be doing. So as you can see, in May to June, the rates were down, and we've slowly climbed up. So July 5th through the 18th, we're at 14.97, and then I determined the next 14-day period, we were at 15. So if we look at the policy options, so one of those, if you have 10 to 20 in that range, they're talking about elementary in-person and middle and high school, kind of a hybrid, so in-person and remote. So this is one of the tools we have been communicating with all the schools, and maybe Cheryl can talk a little bit more about that, but we'll be working with them on utilizing this to help them make some decisions.
Kathy,
Okay.
I had talked to you last week when the information came out from Governor Walz about how can we publicly display this information. Have you had any guidance as to?
Yeah, well, now that we've been able to share it with all the schools and have a little conversation with all the school superintendents, K-12, we'll now post it.
Okay.
So we'll post it on our website as
Okay.
well as on the Facebook page.
Okay, and then do you know I know the population estimates have kind of fluctuated. Do you know what population estimate they're working off of?
We use the 63,999.
Okay, thanks.
63,999 is the population rate, but it does fluctuate, and it depends on where you look to see what the population is. But that was part of the formula that we
Great,
used.
thank you.
Okay, I'll go to Cheryl to talk about immunizations.
So last week, when we were here, I mentioned the potential of having a vaccination clinic, and I was able to order vaccine, and that's being shipped, so we're in good shape for that. So next Monday, August 10th, and Tuesday, August 11th, I'm going to be offering an immunization clinic at our public health clinic in Suite 105 of the Family Service Center. We're going to run this from 8:30 in the morning until 4 o'clock in the afternoon. It's going to be for basically school-age children and older, so we're starting with age 4 and older, so that these children can get caught up with their immunizations. And I've actually gotten requests from some college students that need to get some immunizations as well. So we're going to go through adults. This is going to be by appointment only, since our building remains locked at this time. So they will call our clinic number, which is 218-299-7777, and then press 2 for the second option at the prompt. The majority of the vaccines that we do at our public health clinic are Minnesota vaccine for children, and there is some criteria that you need to be eligible for. So we are going to post that eligibility criteria on our Facebook page as well as our website. And if people have further questions and don't have access to those two modes of information, they can certainly call our clinic number that I just gave, and we'll be happy to answer any questions that they have.
How many people do you expect to take? I mean, how many could you take I mean, if you do by appointment, what are you setting your appointments up at 5-minute intervals, 10-minute?
Usually it's a 15 interval for younger children, just because oftentimes with younger children, there's some apprehension. And just to give a little bit more information to people, we do a lot of education when we give immunizations, so it's not just giving them the vaccine information statement, which we're required to do by federal law, but we answer all sorts of questions when they come in for immunization. So I haven't figured it out as to how many we can take. I am going to have another public health nurse that is going to help me with some immunizations that day, so there'll be 2 of us. And we'll see. We've already have about 10 people that our support staff person in the clinic has been collecting names and numbers of when we could offer these immunizations. So we'll be contacting those people first to give them the opportunity to choose which day and what time they would like to come, and then whatever people call in. We'll also be screening them when they come to the door, because we want to make it clear this is not a walk-in clinic, because we do not want people congregating in the area. So if we have people that come too early, they may be asked to stay in their car until we have our opening, and then we will screen them at the door and encourage them to wear their mask when they come.
Well, if you get more than what you, if they don't have an appointment and they come, what are we just going to send them away, or what's?
It depends. If we already have that time allotment filled for another appointment, then we may have to ask them to reschedule, or they can wait if we have an opening a little bit within the few minutes. But if we are completely booked on our schedule, we may have to ask them to reschedule.
Okay. And just for that information for the public, that number was 299-7777.
Correct.
Okay, go ahead.
I also wanted to mention, as Kathy was talking about the case rate by county, the part of the toolkit for school districts to make their decisions on how to approach their learning methods this year. And we have given this information to all of our school districts in Clay County, and some of the districts have reached out and would like to have a meeting with us just to talk through the data, when we'll be sharing that with them, and also any other questions that they have, because they're also figuring out areas within their school to provide space for children that need to be quarantined, if they do have signs and symptoms of COVID-19, so that they can be placed away from the general area until their parents can come and pick them up. So we'll continue to work with them. I'm still having conversations with all of our higher ed facilities and answering any questions that they may have as well.
All right.
Thank you.
Morning. Just a few highlights from the Minnesota Department of Health press conference yesterday with Commissioner Jan Malcolm and then the infectious disease director, Chris Ersman. So a couple of things they talked about were plasma donations. And so we've talked a little bit about plasma donation and how that helps to treat, but also that it's being used for research. So they highlighted that and really encouraging people to get out there and donate plasma. And then they also were talking about COVID vaccine, and so Minnesota has been chosen as one of the 4 pilot sites in the nation to participate in that, and that is because of their long-term relationship with CDC and providing vaccines. So they were proud of that opportunity, and more information will come on that, but that'll be a future vaccine testing pilot.
Where are the other states?
You know, I don't know that.
Okay.
They didn't mention that in the conference, but we can sure find out. So then another thing is just about antibody testing. And so there's been a lot of discussion about antibody testing and opportunities, but just wanted to make note of the fact that we have opportunities in our community. One is Vitalent. If you donate blood, you can get tested. And then also Sanford Health is promoting antibody testing for anyone. So you don't have to be actually one of their patients. If you are a patient, you're going to get your test results back in 3 to 4 days. If you are not, you'll receive a letter in the mail. And those are, they're not billing insurance, but they're charging a $65 fee for that. And so, again, that kind of just tells us, at that time, we don't know what it means long-term. Same discussion is going on with testing vaccine. Will the vaccine be effective? Can we maintain our immunity with the antibody testing? And so that all is being studied. Going back to the vaccine discussion, they're looking at what will be the long-term coverage of the vaccine. Would we need a booster? Just as an example, when we start young children on flu vaccine, influenza vaccine, they have to have a booster because it takes a second dose to build their immunity. So those were kind of some of the highlights, just wanting to remind people that if you do get antibody testing, you need to continue to follow the guidance for social distancing and masking at this time, because we aren't real clear on whether or not you can spread the disease at that time. So that was pretty much the highlights of yesterday's press conference.
So if I had COVID-19 and I want to donate plasma, how long do I have to wait, or how serious does my COVID-19 have to be that my plasma will be good?
So part of what they're doing if you're donating blood or you're going in for a surgical procedure, or if you're going to donate plasma, is they're screening you for that. So you would not be able to do that. So you'd have to, if they identified that you were positive, you would have that isolation period you'd have to follow, which is the 10 days plus.
Okay, but I heard of people donating blood afterwards, after they've had it, so.
And the plasma donation is what, if you donated plasma and you had COVID and you were over it, and so then at that case, it would possibly protect someone else. So it gives them kind of an immunity boost. And so that's what they're using the plasma for, to treat other people who are critically ill in the hospital, and then also for research purposes. That was
Okay,
the
but
other
how
thing I
sick do
mentioned.
you have to be to donate that plasma? That you've got
Well, I think if you test positive, then you've had the virus, and so that's it. I mean,
I think
that's
that
all
you
I'm
have to
aware.
recover, though.
Yes,
Yeah.
yes.
Yeah, you have to
Again,
be recovered, I
right.
realize that, but if you just had a symptom,
If you
one
test-
symptom and.
If
I
you're
mean-
positive, you're positive, so,
Okay, very good,
Yeah.
thank you.
yeah.
I think to add to that, so if some people are asymptomatic, and some people have just minor symptoms, so it isn't that if you have a minor symptom, you still, and maybe you even didn't get tested, but if you have this antibody test, it will show that you previously had COVID. And so then you'll know. We still don't know what the protection period is, like Jamie mentioned, so we don't know the period of time that you're really going to have some immunity. That's still in the studies.
Okay.
So,
Thank you.
yeah. A couple other things, there's some scams going around, and one of them is that contact tracers or case investigators are asking for credit card information. So if anyone's calling and asking you for some credit card information, that is not a case investigator or a contact tracer. We do not ask for any of that. So just for the general public, if you have someone calling you and asking you for that information, don't give that out, and that is not a case investigator. There's also another letter that's circulating about not wearing masks. It looks like it's an official letter. Some people are receiving that about not wearing masks. So that is not the case. That's not the recommendation. That's not coming from CDC or Minnesota Department of Health. So just a caution to the public. There's those kinds of things that happen, and they're out there, but those are two of the things that are happening that we are aware of right now, so just to be cautious of that. Any questions that we may or may not have answered, or any questions you may have?
Yeah, sure, when's this gonna end? Okay,
Oh, if it only could be tomorrow, right?
no,
Yes, we would love to say it's going to end soon, but
Thank you for what you're doing, and thank you for the update, and appreciate your work that you're doing.
sure, thank you.
Thanks also Kathy for your presence at our CARES Act
Yeah.
committee meetings. I
Yeah.
know that that's been an added task on your list, and I think you're representing the best interests of public health well there, but also the citizens of the county as we look forward to what this may mean for the next six months or so, maybe longer, maybe shorter.
Thank you.